Welcome to this recorded OP webinar, Uncharted Territory for Pediatrics, Responding to the COVID-19 Crisis, Balancing Patient and Practice Needs. I'm Sue Kressly, the Medical Director of Office Practicum. Our agenda for this webinar is to review disaster management principles, to discuss COVID-19 impact on patients and families and how to respond, to evaluate practice team impacts of the crisis, to examine business impacts of COVID-19 and how to mitigate them, and importantly, before we end, we will talk about remembering to take care of ourselves in the midst of the COVID crisis. Let's start by talking about disaster management. While before this COVID crisis, most of us thought about disasters as tornadoes, hurricanes, and fires, it's clear that experiencing a pandemic is a disaster that is affecting all of us, not just those of us who live in a hurricane-susceptible region. There are principles of disaster management as outlined by this National Center for Disaster Preparedness diagram, and there is a hyperlink to more information that you will be able to access in the resources along with this recording. For the OP clients, these links will also be posted in the OP Help Center. At the center of this diagram, please note we must begin by living with resilience. We need to make sure we take care of ourselves, we have our basic needs met, and that means sleep also, and we also know our risks. That includes the availability of personal protective equipment. We should be involved in our community and communicating with our families and our patients. Every disaster has a predictable phase cycle, and depending on where you are geographically and how many cases of COVID-19 are in your community, you may still be in the preparedness phase. Please learn from your colleagues who are further along in this crisis. You may still be operating in standard mode, but get prepared for what is coming near you. During the response phase, where many of us are, the key components are communication, coordination, and saving lives. We have no idea how long this response phase will last, so build in strategies where you can adjust often and communicate effectively. Everything we do in response needs to keep in mind what will need to happen in the recovery phase. And in the mitigation phase, that's where we will likely see changes in our infrastructure that may forever change the way we view our medical homes. If telehealth is going to be our lifeline, what does that look like during and after recovery? Physicians in general are resistant to change. We get nervous that we might make mistakes when we don't have full information and are reacting quickly. But being agile and adjusting quickly is key to getting through this crisis. As the COVID-19 impact changes and recommendations change in your community, you will need to adjust. It is crucial to be consistent in your messaging, both internally to your team and externally to your patients and families. If not everyone is up to date and reinforcing your daily message, it will create anxiety, confusion, and lack of trust. Have someone own the communication and be the point person through this crisis. Consider multiple huddles and having standing communications. My practice is having an early evening provider huddle to discuss any adjustments and practice level decisions. We then communicate to the entire practice team. You must be prepared to adjust often and even midday. Take the time to pause at lunch and discuss what's working, what's not, and what's next. This map from the CDC is a comparison from Sunday the 22nd of March to today the 25th. Washington is starting to have a reduction in new cases, but New York is in the fight for their life. If you are in the north central part of the country and you thought this was going to escape your community, think again and learn from your colleagues who have already been where you are headed. Patients and families, the reason we do what we do every day. Our patients and families come to us as a trusted source of information. They want reassurance, they want frequent contact, and they want touch points with us. They want appropriate care. This is what we're really good at as pediatricians. We just need to have a coordinated, constant voice of reassurance that is planned and thoughtful. If you haven't already, send a mass email to all of your patients and families via your EHR or Constant Contact or MailChimp or any other mail program. Point them to one source of information and updates and have a dedicated person to maintain that information on a regular basis. For my practice, it's our website. We have an alert on the homepage and a click-through link to get to our COVID-19 page, which we update frequently. After you've started this, spread consistent messaging through social media. Reinforce your messaging at all patient contact points, phone calls, portal messages, hold messages on your office phone system, signs on your front door. Carry the same message and update it as you go. Families want and need reassuring messaging. We are their pediatrician they trust. Our loudest voice needs to be, we are here to get through this with you. We want to give the message to call us first. In this time of crisis, maybe we can establish new habits where families reach out to us instead of whatever's most convenient, but that is our message. Contact us first. We are here for you. Ask families to tell you what they need. Answering the phone with, how can I help? Is a good place to start. As you make decisions on a daily basis, let your patients know what's happening. They are taking the journey with you, and they want to hear how you are keeping yourselves and your family safe. We told our families all the steps along the way as we made changes and will continue to do so. Then, think outside the box. That's a picture of my colleague and friend, Dr. Katrina Skinner. She addressed her families on Facebook Live and got incredible feedback that was positive. You might want to make some short videos and put them on your website and/or social media. Families want to hear their pediatrician's voice, both in print and also be able to hear it in audio. Let's focus for a few minutes on the practice team. Internal communication with your practice team is crucial to getting through this. Make sure your entire team is involved and understands where and how they are to receive messages. Don't just use internal messaging of your electronic health record because not everyone may be in it or on it every day. Also consider push messaging, not pull. That means you're sending messages to people, not expecting them to retrieve it. If staff doesn't go to look for information, things get lost, and this is changing way too fast to have things slip through the cracks. Clearly date and time any updates that you make. You may change things midday and you want your staff to know. Text reminders to check for updates or use GroupMe or Slack or Basecamp or whatever you need to remind your clinical team how you can communicate and stay updated. Keep protocols in a Google Docs or Basecamp or on an internal network for easy updates and access, and let staff print them out, but make sure they're dated and timed so people are using the updated versions. You can't over-communicate. Small information bites are best. There is too much going on for people to remember lots of new information. Have multiple huddles, ask for input, and good ideas. Create a culture where all ideas are welcomed and make a decision as a team. Everyone needs to be bought in and committed to getting through this together. Your number one priority must be to protect yourselves and your team members. Screen, and then rescreen every patient. It's amazing how people forget, oh yeah, we were just in England and got back last week and we were told to self-quarantine for 14 days, so maybe it's not such a good idea we come in for tomorrow's well visit. Patient care decisions of who to bring in, who to see in the parking lot, Who to see via telehealth may evolve as the number of cases in your community grows, and also by the amount of personal protective equipment you have. Some of your team members may be afraid to come in the office to work for very legitimate reasons. They may themselves or have someone at home who's in the high-risk category. So how can you protect your patients and your practice team? Many practices are separating well visits from sick visits in multiple ways. In my practice, we are using the dedicated rooms for just well and different dedicated rooms for just sick. We only see well visits in the morning, and we only see sick visits in the evening. Every day the staff calls the next day's wells and reminds them, we encourage you to come for your well visit. We are confident this is a safe environment for you. Here is how we are keeping ourselves and you safe. And we outline our processes, which has changed several times over the past week. Currently, even our well team is wearing gloves and masks for every visit. We ask parents to only bring the child who has the appointment and one parent, and the other parent is welcome to join the conversation by speakerphone. Some reluctant well visits, we have the conversation while in the parking lot on the phone to gather HPI and pertinent information. We bring them in to quickly measure, weigh, and do a quick exam and give immunizations, and then send them back in the parking lot. That has the least amount of exposure to our office, and patients sometimes need that extra step of reassurance. This week, we have a totally separate well team for the morning. That includes docs and staff, and that team leaves at lunch and never physically interacts with the sick team that comes in after lunch. The waiting room has been eliminated. We have signs on the door not to enter. There should be no walk-in hours during this crisis for sick patients. Some practices even lock the door and have directions for families to call the office from the car to once again affirm that they do not have an elevated risk status before entering the office. In my practice, every sick visit is triaged by a nurse. If it's appropriate for a telehealth visit, that's how they are scheduled. If the parent or the nurse feels it needs an in-person visit, anyone with any cough or respiratory symptoms is seen in the car by the physician who has on a gown, mask, goggle, and gloves. We are fortunate for now to have enough PPE to be able to do this. That may change in the future. When scheduling the appointment, the staff takes the copayment over the phone. The family calls the office when they arrive, and they are asked to say what kind of car or color they will be driving so we know how to identify them in the parking lot. The doctor then gets on the phone to take the HPI and some additional review of systems. We do this to minimize the length of time of exposure for the physician with the potentially ill child. The visit is accomplished and the patient drives off while the doctor writes the note in the EHR. And additional follow-up information is often sent via portal message if necessary. Non-respiratory sick patients, if appropriate, are still seen in our office in the sick rooms only, and the doctor wears gloves and mask. As many patients as we can, we are steering towards telehealth visits to reduce foot traffic and exposure for families and our staff alike. So as the SOPA mantra goes, no margin, no mission. And at this point, the mission is being threatened in most pediatric offices because the business has no margin and often significant risk of loss. If this has not yet happened to you, be prepared for a significant reduction in office visits. Do what you can to hang on to well visits as long as safely possible. Preventative care is the lifeblood of pediatrics, both for our business and for our patients. Make your families confident that they'll be safe in your office. Practice with your office team how to deliver the message and what points to make. Call everyone the day before and reinforce the message and make sure they are well, asking them to postpone if either the child or the parent has any signs of illness. Prioritize the infant and toddler well visits with vaccines. The last thing we need is an outbreak of invasive pneumococcal disease or measles in our communities. And ask only one parent to accompany the patient who has the appointment. We're all going to have to be creative about sick visits. For many people on the coast, the average sick volume has dropped by more than 50%, and in some hard-hit areas like New York and northern New Jersey, it's been more like 70% the last few days. You cannot make it through this crisis from a business standpoint without telehealth. Let me repeat, you cannot make it through this crisis without telehealth. If you aren't already up and running, get started immediately. What other action steps can you take? Know your inventory for supplies and especially vaccines, and reduce unnecessary expenses, especially since your visit volume will be down. Pull out your disaster plan. If you don't have a disaster plan, make one. The AAP has a checklist, which is very helpful. It's important to note that even if you have business interruption insurance, which is a great idea for practices if you haven't explored this, it, however, will not apply to pandemics. Consider allowing some of your team members to work from home for billing, scheduling, or triage, or even physicians doing telehealth from their home. Pull out your budget and make adjustments where you can. Not having to pay taxes until July will make a difference to cash flow for both individuals and the business. Right-size your office staff, and that includes your providers. Having 3 doctors in the office to see 12 patients makes no sense and increases everyone's risk of exposure. Maybe ask for volunteers to take vacation now because you're going to need all hands on deck in the months of recovery. Secure a small business loan or access your line of credit so you know how to pay your expenses, including payroll. You may have to make difficult decisions about cutting staff, cutting salaries, or deferring physician paychecks in order for your practice to sustain this crisis. Optimize your telehealth offering. Try to replace some of your in-person visits with virtual ones. Look at your forward calendar and convert those ADD and anxiety depression follow-up visits that were on your schedule for the weeks ahead and start converting those to virtual visits now. Get your providers comfortable with virtual visits when you're not in a crisis mode. Consider virtual walk-in hours for sick patients, much like you did in your office. Then use your communication network and social media to advertise. We have daily walk-in sick patient telehealth visit during scheduled hours, and make sure everyone knows what they are. Next, you may want to recall patients due or overdue for chronic illness rechecks and do them all virtually. Some practices are scheduling a virtual check-in visit with every patient who has asthma to make sure they understand their asthma action plan and they have the medications they may need if they get an illness, including COVID-19, and if they have a flare, they have the medications on hand. Well visits. In some places in the country, practices have been told by the Department of Health that they have had to completely close their offices to sick and well patients. Well visit CPT codes are not in the allowable telehealth approved series, but if this crisis is prolonged, payers may have to get creative about well visits also. While you can't give immunizations virtually, you can't give a comprehensive exam, there's a lot of screening, administration of developmental surveys, depression surveys, education, and anticipatory guidance that can be accomplished very well via a virtual visit. Stay tuned to find out whether the payers will start paying for a virtual well visit. That has not taken hold yet. While you're in the response phase, think ahead to the recovery phase because it will eventually come. We will get through this together. Shifting PTO that was planned for the summer so staff and providers can be home with their families now makes good sense. Ask for volunteers. Get everyone prepared that you may need to cancel all summer vacations to make up those well visits you're deferring now. And as your visits are ramping down, start to plan for the eventual ramp up on the recovery side. You will need to make sure that you have the team and the access to care to accommodate the surge of patients once we get to recovery. If you are wondering what pediatric leadership, including the American Academy of Pediatrics, is doing for you, we are speaking to vaccine manufacturers to request extending their payment terms. We are speaking to payers to advocate for telehealth parity, and there are many states that are starting to mandate it during the crisis. We are making sure that when regions waive patient copays for treatment, that they didn't take the money out of our pocket and the payers will make up the difference. We are also discussing payment for well child visits conducted via telehealth if the crisis is prolonged. And we are advocating for pediatrician access to appropriate PPE so we can keep our office teams as safe as possible. Many practices are worried that if one of their physicians or team members gets COVID, that they may have to shut their doors for 2 weeks while everyone is quarantined. That is one of the reasons my practice chose to separate a well team and to a sick team, so if that happens, we have another team to carry on. Last, but certainly not least, let's discuss maintaining your own mental health. In this time of crisis, take the time to be kind to yourself. Try to leave the office worries outside your home, which is difficult if you're working from home, but try to create at least a sacred space. Limit your own exposure to the constant noise about the crisis and all of the negative numbers and escalation that we are seeing in multiple forums. Don't put your head in the sand, but make a conscious decision at some point in your day to tap out. Make sure you get sleep. Remember to eat and make healthy choices when you do. Find a way to exercise, maybe a family video or take a walk together. Sounds awfully like what we tell our teen patients, doesn't it? Connect virtually with friends and family, maybe have a virtual web-enabled happy hour with good friends on a Friday night. Consider a gratitude journal. We have much to be grateful for in the midst of the crisis. And if you haven't done it already, this is a great time to start practicing mindfulness. Be kind to each other in the office, on social media, in your email conversations, with your spouse, with your family. Be kind. There are several mindfulness apps which are free to healthcare workers during this crisis, including 10% Happier and Headspace. I've included a link to a wellness blog created by a friend of mine, Dr. Mary Brandt, which talks about having a ritual at the end of the day to make sure that you wash away the day's exposure and stress and make your home a safe place. And the AMA has resources on caring for caregivers. Lots of professional resources are available to help you through this crisis. All of these will be listed with a recording for your access. This is the sign that Dr. Brandt put on her home door to remind her when she gets home to shed the stress of the day and feel safe. Thank you for your attention, and most importantly, thank you for caring about the families in your community, and thank you for providing care to them in this crisis and always.